question. How'd you sleep last night? Listen to these symptoms because it might point to a problem that you or someone close to you is struggling with. You go to sleep early, but you wake up really tired. You're gaining weight and you're moody or depressed, but you don't know why. And if you live with other people in the house, this often gets their attention: loud snoring and gasping for breath. For many people with sleep apnea, the prescription is a CPAP machine. Problem is, they stop wearing it. It can be cumbersome and looking like Darth Vader or Bane at bedtime. That can go either way. Some people might like that look, others might not. Dr. Schleicher with Sleep Houston says the CPAP can work for some people, but he has other options as well. He joins us with his patient, Juan Flores, who is finally getting a good night's sleep and feels so much better during the day, too. Good morning.
Good morning, Deborah. Thanks for having us on.
Absolutely. You know, when it comes to sleep, I know a lot of people who are like, they're struggling with their sleep and they're not quite sure which doctor to go to, and they might not think a dentist, but you actually specialize in sleep dentistry. Explain what that is.
Well, sleep dentistry, I got into this accidentally. I was my first patient about 25 years ago. I was actually banished from the bedroom by my wife.
How many couples, if they're not sleeping in the same room, the reason why is?
It's snoring.
Yeah.
I was snoring. She actually recorded me. She said, "This is you snoring." I said, "That's not me. It couldn't possibly be me." My son says, "Yes, that's you, Dad."
And that's the problem for a lot of people who might not have somebody in the room to tell them. They don't even realize it. But when we look at you and you're snoring like that, we're thinking they are getting the best night's sleep of their life and keeping me up. But it's not really the best night's sleep, is it?
Right. You're actually impeding the ability for the air to get into your lungs. It stops. Patients stop breathing here. So after a couple of years in the bedroom, I started to fool around with oral appliances, cured my own snoring. I did not know at the time that I had obstructive sleep apnea. Right. I just thought I snored. It was 25 years ago. It wasn't on everybody's radar like it is now.
Right.
Now it's a buzz topic. Now everybody is aware of sleep apnea. Doctors are aware of it. The medical community is aware of it. And patients now are becoming aware of it.
Yeah.
So
you were in the guest bedroom. Now you're back.
Oh, I'm back in bed with my wife.
Okay, you are not only a sleep dentistry expert, but you're also a marriage counselor. A lot of people actually, a lot of your patients joke about that and say you got us back together in the bedroom. All right, you're saying how many people are aware of it now, including doctors. That's because it can be downright dangerous. We have to have our sleep.
Oh yeah, everything is related to sleep. Everything basically is related to oxygen to your brain. Your brain's 5% of your body weight takes 25% of your oxygen content. If you're not getting that oxygen at night because your airway's closing or you stop breathing during the night, which is what patients with obstructive sleep apnea have, that brain's not getting that oxygen. All kinds of bad things start to happen.
Yeah.
Endocrine disorders, hormonal disorders, serotonin levels, feel-good, depression,
weight gain,
diabetes, cardiovascular issues, hypertension, cardiac arrest, stroke. It's all related.
It can be deadly. People have not, didn't wake up the next day because of sleep
correct.
apnea. All right, what causes it?
It's caused because your airway right here collapses. What is the airway? The airway is the tube that goes from your nose to your lungs. It's essentially a hollow, collapsible tube, muscular tube, held open with 10 dilator muscles. Dilator muscles make things open up, like your pupils dilate, they get bigger.
Yeah.
Where your airway right now, Deborah, your airway's fully open. You don't have sleep apnea when you're awake.
Right.
You have sleep apnea when
so
you
don't
go to
realize
sleep.
It, right? Yeah.
So you go to sleep. Here's wakefulness. You drop into stage 1 sleep. Dog barks, horn honks, you wake up. Stage 2, a little deeper. We're trying to get to stage 3 sleep, which is about 60 minutes into your sleep cycle. But what happens at 60 minutes when you enter stage 3 sleep, all your muscles relax. They got to get fixed too, so your muscles relax to let the blood flow in, your airway collapses. Now you lock up and you stop breathing 20, 30, 40 seconds into your sleep cycle. Your brain picks that up. Your brain tells you to clench your teeth, or it wakes you up in order to breathe. So patients will wake up and they can't get back to sleep because the adrenaline got put into their body, and so they do not have a restful sleep.
Yeah. Juan, a lot of those symptoms sound familiar to you, but like so many people, you didn't realize that was the problem. Tell us what your symptoms were, and when did you make the connection to this thing called sleep apnea?
Well, I had a lot of brain fog. I wake up, go to work, and I was sleeping like on my, while driving.
Yeah.
It's scary.
Yeah.
So I was gasping for air. So it was really bad.
Yeah. I mean, you didn't realize you were snoring like that, but you knew you were waking up in the middle of the night?
Exactly.
Yeah.
But I was waking up in the middle of the night, gasping for air, but I didn't know why.
Yeah. All right, so now you know why, but you say the reason why you really love being at Sleep Houston too is that they don't only help you with the finding out why, but they help you access the right care. You were trying to find an in-network doctor. That was a problem, just finding out the right person to go to. You impacted tonsil surgery, all that type of stuff. You were trying to figure out, what do I do? And you say you're so thankful that they were able to help you connect those dots.
Exactly. They told me what to do, how to do it, and go on the right path.
Yeah, to make sure you had insurance cover this, because insurance covers the things. I know people have their issues with insurance companies, but what makes them cover something is when they can clearly see it as not just an aesthetic issue or a lifestyle issue, but a health issue.
Right. So this is a medical issue. I'm a dentist treating a medical problem. So we just direct the patients. We have to have a medical grade sleep test to identify that they have obstructive sleep apnea. With that, we can file a medical claim for the patient, and they can get the medicine, the treatment made, covered by their medical insurance. Not dental insurance. I'm a dentist. It's a medical claim.
Okay, so when people come in, not everyone's obstruction is the same, so you obviously got to diagnose that they have sleep apnea with that sleep test you talked about and the reason why. And there are different things that can apply to them getting better, lifestyle changes, customizable oral appliances. Let's talk about that. So here's Darth Vader right here. This is the one that a lot of people are familiar with.
Yeah, you can sleep like this.
Yeah.
Does that look like fun?
That does not look like fun. If you're a tosser and turner, you could wake up and strangle yourself. I'm just like, so that's the traditional CPAP machine. You have something that's much smaller and much easier. In fact, you use yourself and you have it with you right here.
Yes. So remember, our airway collapses because our tongue and muscles collapse. Your tongue is attached to your chin right here. If we bring your chin forward, brings your tongue off the back of the throat, opens your airway naturally, and you do not collapse during the night. So instead of air blowing your tongue out of the way and your airway open, your tongue is forward, your airway is open. And this is all it is. It's just a simple two-piece.
And that's customized to your, right? So it's comfortable to put in. There you go.
Got it.
Yeah. And when you go to sleep.
No problem.
Yeah.
My chin is held forward. I can talk barely. Okay. Right.
Put in, you go night-night, and that's it.
You can wear this or you can wear that.
Yeah.
So as long as your airway is open, you're going to get the oxygen you need. You're not going to have the issues with all the comorbidities associated with obstructive sleep apnea, and you're going to feel better. And it's the thing that's amazing for our patients. It's not a couple of months. You start feeling better within days.
Yeah.
Sometimes overnight.
Yeah. Were you like shocked when you actually slept through the night?
Exactly. I was completely shocked. It made my life change. So I woke up more energetic. I didn't sleep at the wheel. No more like any fog in my brain or nothing.
Because I walked in the green room this morning, he was doing push-ups and things. He was like fully awake. But no, and he mentioned that falling asleep at the wheel. We know, like, especially when people, that's their industry as truck drivers and things like that, is so critical that obviously does not happen. Who is this particular process for, and who should be coming in to see you?
Anybody that's having trouble with their CPAP. Studies show 65% of CPAP users discontinue use within 90 days. Now the CPAP's in the closet. They're getting no treatment. If you're having trouble with your CPAP, come in. There's a better way. 5-10 years ago, nobody knew about these appliances. They've been out there, but now, because of the awareness, people are ready. There is a reasonable and effective alternative to CPAP. And it's right here, this little appliance.
Yeah.
It's amazing.
You come in, you get assessed.
Something so simple that can do so great things for a complex problem.
And when it comes to like the process, it includes scans to check any obstruction and how that all works during that sleep test.
When a patient comes in, we're going to take a CT scan of their airway. And that's also something, we'll give them a copy of that CT scan to take to their other doctors also. So we can see what the problem is. We don't want to treat them if there's not a problem, but they're there because of the problem. If we can treat them and show on a CT scan their airway open using this, we know that they're going to do well.
All right, well, sweet dreams. Thank you very much, gentlemen. Sleep Houston is offering a special promotion today. If you call now, each patient will receive a flash drive with that copy of their CT scan of their airway and TMJ. This is a $250 medical grade image you can share with other physicians like an ENT or an internist. If you're ready to get a good night's rest and get out of the guest room or doghouse, make an appointment with Dr. Schleicher today. You can contact Sleep Houston at 713-8 713-828-8587. Again, that number is 713-828-8587. Visit their website at sleephouston.com, or you can scan the QR code that is on your screen right now. And I love, of course, the name Sleep Houston. You can't get any better than that. Thank you very much.